Why is a biopsy crucial for Ewing sarcoma diagnosis? When it comes to diagnosing Ewing sarcoma, a biopsy is a vital step. But why is it so important? A biopsy is the only way to definitively confirm the presence of this specific type of bone cancer. While imaging tests like X-rays, magnetic resonance imaging, and computed tomography scans can suggest a tumor, they cannot provide the detailed information needed to make an accurate diagnosis. Only a biopsy allows doctors to examine tumor tissue under a microscope, which is essential for distinguishing Ewing sarcoma from other cancers or benign conditions. One of the main reasons a biopsy is crucial is that it provides a definitive diagnosis. Ewing sarcoma is classified as a small round cell tumor, and it can look similar to other cancers or benign lesions on imaging studies. By obtaining tissue samples for microscopic examination, pathologists can confirm the diagnosis accurately. This process may also include molecular testing, which can identify specific genetic markers associated with Ewing sarcoma. Another key aspect of a biopsy is the histological and molecular analysis it allows. Not only does it confirm the presence of cancer, but it also helps pathologists identify the specific subtype of sarcoma. This information is critical because it can guide treatment decisions and provide insight into prognosis. For instance, certain genetic tests can reveal characteristic gene fusions that are unique to Ewing sarcoma, helping healthcare providers tailor treatment plans to individual patients. Planning the biopsy method and site is also essential. Specialists experienced in bone tumors must carefully coordinate this process to avoid complications. This ensures that the biopsy does not interfere with any future surgeries or radiation therapy. Proper planning can significantly optimize treatment outcomes. Moreover, obtaining adequate tissue is crucial for an accurate diagnosis. Ewing sarcoma diagnosis often requires more tissue than what can be collected through fine needle aspiration alone. Therefore, an open surgical biopsy or a core needle biopsy under imaging guidance is preferred. These methods help retrieve representative tumor tissue, which includes valuable tumor areas rather than necrotic or cystic parts. Lastly, Ewing sarcoma can mimic other bone tumors and soft tissue masses on imaging studies. A biopsy is the only definitive way to distinguish it from other malignancies or benign lesions. This distinction is vital for ensuring that patients receive the appropriate therapy. Typically, the biopsy is performed by an orthopedic oncologist or a surgeon who specializes in bone cancers. The choice between an open or needle biopsy depends on the tumor's location and the findings from imaging studies. Magnetic resonance imaging is often used to guide the biopsy, targeting solid tumor areas while avoiding necrosis or hemorrhage. In summary, a biopsy is indispensable for diagnosing Ewing sarcoma. It provides the precise tissue diagnosis and molecular information necessary for accurate identification, staging, and personalized treatment planning for this aggressive bone cancer. Proper technique and coordination with the treatment team are critical to optimizing patient outcomes and minimizing complications. Always consult healthcare professionals for personalized medical advice.